Good morning, this is Joanne, and this is my video for phase 2 of course D156, Business Case Analysis for Healthcare Improvement Project. So this video will talk about findings of my Affinity, Impact, and Swot Analysis. So the different analysis that I have conducted helped me decide what to focus on in my chosen HIP. And I was actually amazed to find out that the stakeholders I chose for this project were all in when I discussed what my purpose was. And they were also appreciative that someone like me is showing interest in what they do, especially for the sake of the patients and for the facility. So during the brainstorming, which we did via phone calls, I gathered their input and then later on categorized them into 3 factors that cause patients to go back to the ER or acute care and then end up being admitted. My HIP, by the way, is reduction of preventable hospital readmissions within 30 days post-discharge. So I also learned that most of the reasons of readmission could have been prevented in the first place. I also learned earlier in the course that there is a program that was put in place by Medicare called HRRP, which stands for Hospital Readmission Reduction Program, and facilities are actually fined and penalized or not reimbursed when their discharged patients get readmitted within 30 days post-discharge. So I found this topic interesting, and so with the support of the stakeholders and my SME, I am hoping to come up with an effective proposal to help with significantly decreasing the rate of preventable hospital readmissions within 30 days post-discharge to home or nursing home. Based on the impact and SWOT analysis that I did, the expected benefits of conducting the HIP outweighs the costs or the risks with an impact ratio of 1.8. My benefits are the categories are the quality of care and the finances and the costs. So under quality of care, improvement benefits would include reinforcement of discharge teachings prior to discharge and the initiation of education on day 1 of admission. And also consistent follow-up post-discharge to clarify misunderstandings and reinforce educations and ensure follow-ups with PCPs and clinics or therapies outpatient should be ongoing or done. And then the second category is the finances or the costs. And the hospital, one of the benefits, of course, is the hospital will avoid being fined or penalized. And then there is decrease of non-reimbursements of payments. For the risks, the categories I included are practices and then finances and resources. So the project risks involves the lack of education of patients and then and staff as well. Therefore, they are refusing or there's resistance to the change. And sometimes this is because of the longevity of their tenure as well. So these are mostly the seniors. And the second category is the finances or resources, where there is lack of manpower and equipment to perform the job, since we have a lot of high turnover because of travelers and residents that rotate quarterly, so there's lack of continuity of care, and there is constant re-education of new staff, which is costly for the facility. And then performing the follow-up calls or virtual calls or in-person visits is also time consuming. It's time consuming to track down patients, especially if they change numbers or they're homeless or they're out of state. So there is a proposal to introduce a digital system to easily track down patients post-discharge. For my SWOT analysis, the internal criteria are commitment, leadership, governance, resources, funding, and processes. And strengths include the quality improvement leadership are in full support of the project, and also there are guidelines in place to reduce readmissions of preventable causes within 30 days post-discharge. The weaknesses, though, is as mentioned in the impact analysis, because of lack of continuity of care, because of the rotation and high turnover of staff and physicians, there is lack of engagement and continuity of care. And then resources may be costly, manpower, manpower, time, software, and equipment. And also there is staffing issues that include general risk of lack of personnel to carry out the QI initiatives. And for the external criteria, I identified legislative and financial environment, stakeholder involvement, development of knowledge, uptake in disseminated knowledge of best practices, and the technology development. Opportunities include stakeholders will see this project as an opportunity to improve practices, so there's stakeholder buy-in. And then there's development of multidisciplinary root cause analysis conferences for patients that fit within the readmission parameters, and then to identify whether that readmission could have been avoided or not. And then also there is a possibility, an opportunity for staff to reinforce their education because of an introduction of a new process or current EBPs or best practices. And then a development of a software to track down discharged patients post-discharge. And also the major opportunity that we are looking at is the value-based care implementation, where this will greatly impact the patients and the organizations, and then which of course patients will incur less out-of-pocket fees for better outcomes, and then the facility will improve care coordination and better cost control due to incentives and improved technologies. For the threats, there's lack of resources by the patients, like no PCPs or transportation or support system, and so on and so forth. And there is also increased need for staffing and specialized personnel to carry out quality indicator projects or initiatives. And this is an added expense which is not covered by the fee-for-service reimbursement model. And also another threat is the low census due to a screening of patients that are ready for rehabilitation. So thank you for listening.